Hi guys, today I am going to talk about my drug ranitidine. Ranitidine has several trade names, which includes aborranitidine, Zantac, Zantac 75, Zantac 150, and Zantac Efferdose. Ranitidine is used to treat and prevent gastric ulcers, pathological GI hypersecretion, gastroesophageal reflux disease, also known as GERD, and it helps with the maintenance of healed erosive esophagitis. The over-the-counter dosage of ranitidine relieves heartburn and acid indigestion. Off-label uses is used to prevent aspiration pneumonia, upper GI bleeding, and stress-induced ulcers. Some adverse effects of ranitidine include reversible hepatitis and hematological disorders. Side effects include headache, constipation, diarrhea, nausea, vomiting, and stomach pain. There is no known contraindications for ranitidine. However, it should be used with caution in patients with renal or hepatic impairment and history of acute porphyria. Some drug interactions. Magnesium or aluminum antacids may decrease the absorption of ranitidine. Ranitidine may decrease the absorption of atazanavir, itraconazole, or ketoconazole, and there is no known herbal or food interactions. Medication administration. For IV push, dilute 50 mg of ranitidine with 20 ml of 0.9% NaCl D5W and administer it over a minimum of 5 minutes. For intermittent IV infusion, dilute 50 mg with 0.9% NaCl D5W to a maximum concentration of 0.5 mg per milliliter. The IV piggyback solution is stable for 48 hours at room temperature. The PO medication is best given with meals or at bedtime. Pediatric dosing. For duodenal ulcers, gastric ulcers, and GERD, the oral concentration for children is 4 to 8 mg per kilogram per day divided BID. The maintenance dosage is 2 to 4 mg per kilogram per day daily. For erosive esophagitis, the oral concentration for children is 5 to 10 mg per kilogram per day in 2 divided doses. The usual doses for IV children is 1 mg per kilogram for one dose, then it is maintained at 0.08 to 0.17 mg per kilogram per hour. The oral concentration for neonates is 2 mg per kilogram per day divided BID. The IV concentration for neonates is initially at 1.5 mg per kilogram per dose, then it is increased to 1.5 to 2 mg per kilogram per day in divided doses. BID. Some nursing interventions. The nurse should obtain history of epigastric or abdominal pain, obtain the baseline of hepatic and renal function test, monitor serum AST, ALT, creatinine, and BUN concentration, assess for the presence of abdominal pain and DI distress. Client education. The nurse should teach the patient that smoking decreases the effectiveness of the medication. Do not take ranitidine within 1 hour of magnesium or aluminum containing antacids. Transient burning or pruritus may occur with IV administration. Teach the patient to report headache and avoid the usage of alcohol and aspirin. Next, I have a video. And lastly, here are my references.